Okay, let's get going with our flow of the blood back toward the heart, and that's going to occur. Deoxygenated blood is going to flow back by way of veins, as you can see up here. And some terminology here you need to make sure you're familiar with. So we say that blood drains back toward the heart. So veins drain blood. In other words, if we want to talk about the arteries and say blood flows from the axillary artery into the brachial artery, we trace it backwards when we use this terminology. We say blood drains from the brachial artery into the axillary artery. So it's the reverse order as it drains back toward the heart. So the first vessel we have here highlighted already, okay, is the blood that drains from the brain and the sinuses here, and that's the internal jugular vein. So let's see if we can get this to show up. That's why we had to start this over again. Okay, pen's not writing very well. So that's the internal jugular vein, right? The one right next to it over here, we'll just label it on the other side here. That's going to be the external jugular, and that drains blood from the side of the head and the muscles of the face, etc. So that's the external jugular vein over there. Okay. Now, something really important to note here. All right. Blood is going to drain back into the heart by way of this large vessel here, which is the superior vena cava. So I'm just going to abbreviate that, SVC, superior vena cava. Hopefully you can see this pin, okay? Now, what drains into the superior vena cava? This is where it's really important. If you remember in the arteries, we only had a single brachiocephalic artery. But here, since we don't have an arch going to one side or the other, vena cava just drains straight back down here, we have a right and a left brachiocephalic vein. So really important to remember, one brachiocephalic artery, but two brachiocephalic veins, all right? So what drains into the brachiocephalic veins? Right here, same order as we did before. So this is just going to be our subclavian vein that drains into the brachiocephalic. Subclavian. All right, that's our subclavian vein right there. All right, and then we're just going to trace this out back the same way we came in with the arm. So I'm going to go over to this side over here, and we're just going to do this right arm. And what we're going to write down here, all right, in just a second. We're going to write down on the right arm, we're going to call this our deep, the deep blood vessels, okay? So I'm going to highlight those in blue and say these on this side are the deep ones. So we're going to trace this out like this, right? And we're going to bring this down right the middle here, and we're going to split down here in the forearm just the same way we did when we did the arteries. So the one coming down from the axillary artery, all right? So we'll label the axillary. Let's label the axillary over on this side. So here's our axillary right here. It drains into the subclavian, okay? So the axillary on the right side, the deep vessels, the one in the arm is going to be the brachial artery, all right? And then the one on the lateral side of the arm out here, we're going to call that the lateral side or thumb side. Since it's on the outside, we're going to say that's the radial artery right there. And we're going to draw a line to the one on the inside and label that as our ulnar vein. Okay, radial vein, ulnar vein. If I said artery, excuse me, we're talking veins here, okay? Radial ulnar vein, so they're almost exactly like we just saw with the arteries, okay? Now on this side over here, down the left arm, we're gonna choose to label this left arm a little bit differently, okay? And I'm looking for my other colored pen, my other highlighter, which I don't see right here with me. Okay, so we're going to label this side over here as our superficial drainage of blood, okay? So over here, we're going to put superficial. So in the arm, and even on the arm model, when you look in the atlas and study the models on the video that I send you, you'll see you have superficial and deep blood vessels. So I'm going to use this yellow highlighter. So here's our axillary artery, which by the way is present both sides, deep and superficial. And from there we're going to split, and we're going to go down the outside of the arm here, come all the way down. This one's going to come inside the arm here and all the way down. Yeah. And we're going to connect those two at that point right there. So these blood vessels on the superficial side, okay, the one on the outside is referred to as the cephalic vein. Okay, so that's the cephalic vein. The one on the inside is called the basilic vein. Okay, so we have a cephalic vein and a basilic vein, which is medial. Okay, then what connects the two of them right here is this connecting point. Okay, this is the median cubital vein, median cubital vein, and that's a good place where we obviously use that to draw blood from. Okay, the one going right down in between the two, between the radial and the ulnar in there. Okay, yeah, there's an interosseous artery as well in there, but now you're seeing your two deep ones down in there. Okay, radial and ulnar. All right. We have digital veins as well down here, so let's throw those in there just so we don't forget. Okay, because they're on the model that way. So those are the digital veins. So again, you have deep circulation, which is the same as the arteries, and you have the superficial vessels here on this side. All right. So let's go back to our picture here. I want to put an asterisk kind of right in the center here. As soon as my focus comes back, there we go. And I want to take a note of this and put it up here. There is a vein called the azygos vein. The azygos vein, you'll see it on the heart models. It's the last vein to enter the superior vena cava right before it goes into the heart. So it kind of drains the thorax. Okay. As we go down here, now obviously bringing blood back to our heart from below. Okay, back up this way. If you remember what drains into our right atrium, okay, this is going to be our inferior vena cava right there. So we'll go ahead and label that now. And we're going to talk the branches that come off of this. So these two branches, these first two, are the hepatic veins, which drain blood from our liver, obviously. Okay, so those are our hepatic veins. Your version may or may not have this vessel actually showing in it right there. If it does show, okay, these are just branches right here coming off of the suprarenal veins, okay, and the main branch right here, obviously these two, which are draining blood from our kidneys, then would be our renal veins here. Okay, and these branches coming off of the renal vein here and off of the inferior vena cava here are gonadal veins. All right, the one coming up here, all right, are the ascending lumbar veins, and they're in the lower back right there. Okay, and then we're going to have this same split that we saw earlier when we looked at the arteries. So we're going to come down this way, and let's just color these in this way like this, and go down from there, and we'll kind of keep those that way for right now. Okay, so on the right and left sides, we have the internal iliac veins, INT, iliac veins, right and left. The ones going to the inside here would be the internal, these are the internal iliac. I messed that up for you guys. All right, so these are the right and left common iliac. All right, so hopefully without having to make the whole video over again, we get that fixed. Give you a second to kind of erase your marks if you have to erase something there. Okay, just like we had the right and left common iliac arteries draining into the aorta, you have flowing from the aorta. Now we have the right and left common iliac arteries draining into the inferior vena cava. These are the internal iliac veins. This then down here would obviously be our external iliac veins. Okay, right in our thigh, femoral vein. Okay. Behind our knee, let's move it down a little bit, get it focused again. Hopefully we get focused here, so let's try that. And there we go. Okay. Behind our knee, we have the popliteal vein. Okay. And then this here, these two are pointing to the ones behind. So this is our posterior tibial veins here. Posterior tibial, and the one in the front right here obviously is going to be the anterior tibial veins right there. Okay, we have a couple down in the foot that we have to cover. Okay, so the one going right across the top of the foot there is referred to or named the dorsal venous arch. So that's the dorsal venous arch right there. And then obviously going to our toes and stuff, we have digital veins as well. Okay, now we have a couple other blood vessels we got to cover in. All right, this one right here, we're using our yellow pen. Okay, because this is a superficial vessel and it's actually the longest veins in the body. If you want to make a note of that, this is known as the great saphenous. Some people say saphenous, great saphenous vein. All right, and when somebody has like open heart surgery and they actually go in and they have a bypass done, oftentimes they will take the great saphenous vein and use that as the bypass vessel, all right, when they do surgery like that. Okay, so I think that's all we have there that we have to label on our mark. Oh, we do have our peroneal or fibular vein, so let's mark that here. Okay, so that's going to be our fibular. We'll just label this fibular vein right there, coming down between the anterior and posterior tibial veins right there. Okay, so that is the venous drainage as it goes back toward the heart.